First, in today's health headlines, we are talking about cruises in light of the recent hantavirus outbreak. If you are planning a cruise, we're going to have for you everything that you need to know. Joining us live is Dr. Scott Roberts, Yale Medicine infectious diseases specialist and assistant professor at Yale School of Medicine. Hi, Dr. Roberts. Thanks so much for being here.
Hi, thanks for having me.
We've been hearing a lot about hantavirus in the news, but for those viewers that are maybe seeking a little bit more detail, what is hantavirus and where does it come from?
Hantaviruses are a group of viruses that primarily live in rodents. There are several hundred cases in the US since the early 90s, and almost always the story we hear is somebody was exposed to a rodent somehow. Maybe they were cleaning out an old house or a crawl space. There's been one case in Connecticut in 2014, and this was not acquired in Connecticut. It was somebody who went to Vermont and was living in a cabin. There is one strain of hantavirus in Argentina, though, that spreads person to person. Most strains do not. And this is the strain that's now spreading on the cruise ship.
Gotcha. So in all of this time, we have only had one case in Connecticut in recorded history.
That's correct. And currently, none of the exposed individuals from the cruise ship live in the state of Connecticut. So right now, there's really no concern right now for Connecticut.
All right. So we're talking about cruise ships, we're talking about hantavirus, and I think a lot of us are wondering, among us, we were certainly talking in commercial break about this, how is it that you can get hantavirus from a cruise ship, especially if, like you mentioned, this comes from rat urine, rat droppings? How do you have exposure to that while on a cruise ship? And especially since you mentioned that this typically isn't transmitted among humans.
Right, that's a great question. And the one exception to that rule is this specific strain in Argentina. So what seems like happened is somebody off the cruise ship got infected somehow in Argentina, came on the cruise ship, developed symptoms, and then at that point it started to spread among some individuals in the cruise ship. Any scenario that packs a lot of people in a small space for a long period of time, it just creates conditions that are ripe to spreading any disease, not just hantavirus. So things like COVID and norovirus, which is much more contagious, are things I'd be more worried about.
You know, we're watching all of these developments with the passengers at the center of the hantavirus outbreak in the news. You're watching this unfold in real time. Should people be panicked?
No, certainly not. This is not like COVID. It doesn't spread like COVID. It is broadly much less contagious. And so really what I've been advising is, follow your public health guidance. So the CDC, the state public health department, right now, because it spreads so poorly, there's been nobody who has not been on the ship get infected. So right now, all positive cases are people who were directly exposed to the index case on the ship.
All right, doctor. Oh, I'm sorry. I didn't mean to cut you off.
No, right now, certainly I would not worry about this right now.
Okay, good to know. And quickly, doctor, summer is coming up. Many people have vacations planned on cruise ships. Would you give them any advice right now?
I love cruises. I've been on them. This is just a bad sequence of events that led to this. I'm much more worried about COVID, flu, and norovirus. And the bread and butter tools still work. So washing hands with soap and water, avoiding people who are sick, staying updated on vaccines, all that's going to help you stay safe on a cruise.
All right, all good advice there. Thank you so much for your time today and for clarifying this outbreak again as it unfolds in real time. Dr. Scott Roberts, we thank you for your time today.